We talk a lot about the cliff that you fall off of once you finish treatment and you're just sort of in the survivor land without a plan, without action, worrying it's gonna come back. You're trying to figure out your life, your body's all crazy. You know, breast cancer is like the most common cancer. All of us have heard about it, like way too much, but I still didn't relate that to myself, you know? I was early 40s, which is, you know, older, but not like old. So I wasn't even thinking about screening for breast cancer myself when I was diagnosed with it.
How did you find out that you had cancer?
Yeah, so I was too young to do the recommended mammograms. I think they weren't starting till age 45 or 50 or something at the time. I know there's been some changes in the screening rules. And we should start younger because the rates are rising unfortunately, so much quicker of younger women, women under 50 and even under 40 are getting breast cancer specifically.
Wow.
So we should actually start screening.
Yeah.
But I wasn't. And I had felt that my whole top half was one of my right breast had turned hard, but it wasn't a lump. And I think I just thought breast cancer was kind of a lump because I'd heard it. You know, I'd heard about the self-exam thing, which now I do all the time. I'm actually now a trained advocate with a group called Know Your Lemons. And I know, there's a whole thing. And we talk about, you know, promoting self-exams for people. But I didn't know that back then. And so I just thought, oh, that's kind of weird. Some weird changes in my body. I mentioned it to my primary care provider. And he was like, well, you know, you can maybe get a mammogram. Like I can write up an order for you and you can try to get one, but it's probably nothing. Just bodies change. It's like your skin's getting thicker in one area. It's not a big deal. And then I couldn't get a mammogram because like the list was so long. Like appointments were 6 months out. And I was like, I don't need this. So I didn't even do it. So I actually ignored it for a year and a half.
Holy smokes.
I know. But that's part of my story is that sometimes you just don't believe that it can happen to you or believe that it matters to take care of your health. But it does, right? Yeah. So if I had prioritized my own health and let my instincts a little bit, listen to that, and not just a doctor who thought I was too young for anything serious, then maybe I would have caught it sooner and it would not have been stage 3 at the time that I caught it.
Wow.
Yeah.
So how did you get to that point a year and a half later?
I would love to tell you that story because we are sitting in the house of one of my old high school friends, Lisa, and she's the one who was like, hey, you really need to go get this checked out. And I was like, yeah, I know. Yeah, whatever. Yeah, for sure. Yeah.
Because was it growing? Like, was it spreading?
Yeah. And then I started to have pain in my armpit, which is another sign. I didn't know that back then.
Yeah.
I now know that. And she was like, no, you really got to get. I was like, yeah. Oh, for sure. I'll make an appointment. Oh, for sure. You know, and I didn't. And she's like, I am not talking to you again until you make this appointment.
Wow.
And the tough love of a friend, right?
Yeah.
Made me make the appointment. So then I got my first ever mammogram and I found out right away. Although they couldn't confirm until they did a full biopsy, which I had that day. They saw the mass and it was so ridiculously large that they were able to just say, this is pretty much cancer. Can you stay for a biopsy so we can officially confirm it? And I did stay for a biopsy and we had to wait for those official tests to come back a week later, but I already knew.
Yeah.
Yeah. The doctors are pretty clear and without able to say it, they kind of said it. So.
What were your initial thoughts or feelings when they said that? Yeah.
Just like stunned. You're just kind of empty, you know? There's a lot of guilt of, oh, why didn't I take care of myself better? As if I could have really prevented cancer. You can't.
When you got the diagnosis and I assume they gave you kind of the outlook of like, this is what could or will happen and stuff. What was kind of the things that they were telling you to expect? Yeah, so we knew right away I had a very common form of breast cancer. It's hormone driven, and it was HER2 negative on one of the like protein things, which is great because it means there's a lot of treatment options that we are pretty sure works because it's so common. Thousands of people have had these exact treatments and it's worked for them. So I was sort of lucky to have a very common treatable form of breast cancer. There's many different forms.
but it was pretty advanced. So we knew that we'd have to be aggressive with the treatment and do the maximum possible of everything. And that was both good and scary to hear, because as soon as there was like a Monday meeting of, you get to meet all your doctors and they go through the whole plan and they come in one at a time. And I was able to hear the whole plan, and scary, but I instantly just kind of like turned on that action mode. Okay, let's just do this. Let's do it. Let's do everything. Let's do the maximum. Let's just do it. And then because I was so focused on doing it, that helped me to be less scared, because you're taking action and you're doing something. And I think a lot of us survivors going through treatment kind of get in that action mode. And that is great because it just helps you go through it, And then there's people cheering you on and you're like, yay. And then you're just doing it. And then suddenly when you finish treatment, that's when it's harder. We talk a lot about the cliff that you fall off of once you finish treatment, and you're just sort of in the survivor land, just floating out there without a plan, without action, worrying it's going to come back, without people cheering you on. You're trying to figure out your life. Your body's all crazy, mentally, emotionally, physically. You're just a mess. And that was probably the harder time. But the treatment part was not easy. Like, I'll never say easy, but it was easier for me because I could just focus on it and do it and just get it done,
Was there anything you think, looking back now, that could have prepared you for that cliff?
No.
So it's just a matter of
Yeah.
getting more people to be prepared for it, I guess?
Yeah, I mean, part of sharing my story is definitely the survivorship aspect of what happens after and supporting each other through that. I'm helping to co-lead a support group in LA for that. So really the key is just to be there.
Yeah.
And I would say that that's so important for friends and family of anyone going through, and I'm going to just use cancer only because I'm sure there's many hard experiences where it's similar. But what I know is for friends and family, if you're trying to support someone who's going through cancer treatment and the diagnosis and all of that, yes, be there. That's awesome. But it's like when they're done, they really still need you because they're trying to get back into life and everything looks different now. So if you could just continue to be there, to me, that's when it was the hardest. And I think a lot of us feel that way.
Would you mind sharing some like specific examples that you experienced as far as when you're saying like it was difficult to get back into?
During the main part of treatment, and I did the 3 main things, so chemo, surgeries, and radiation. Not every cancer is treated this way. Not every breast cancer patient has to have all 3 of those things. It'll depend on so many factors. But while you're going through that, you have this whole team behind you. You have this medical team, right? That's checking in on you. Sometimes every week, depending on what you're doing. Like if you're at chemo once a week, you're getting your blood drawn every week. They're checking your labs. They're talking to you about side effects and symptoms. You have nurses watching you while you're receiving chemo to make sure you're doing okay and not having any reactions. I mean, there's just so much support.
Yeah.
And then you kind of like finish treatment and they're like, all right, see you in 6 months. And you're like, whoa, what? But I love you and I need you to see me every week and take care of me. They're like, no, you're fine. Your scans are clear. Like, we'll see you in 6 months for more scans. And you're just like, oh my God. So losing your medical team, I mean, they're still there for you. I mean, I don't mean to exaggerate. Obviously, you still see them, but the frequency and their attention changes and you just don't know how to take care of yourself. That part is so hard for so many of us. So yeah, that would be the main one, I think. And then work, like, if you had stopped work, if you were lucky enough to be able to take time off from work to focus on treatment, I was able to take time off for different surgeries, which you have to. But like during chemo and radiation, I worked through it. A lot of us have to. You just don't have as much time off. But even then, suddenly you're done and work is expecting you back full time if you're lucky to still have your same job, right? And that's not even the case for so many people. Like, can you still mentally do this job? Do you still have the stamina for your job? Like, and also, can you really even do this? And then answer all the questions of your coworkers, but also like, just do your job. Like, it's so hard.
Yeah.
Just navigating all that is difficult. And I think that's the same for most of us going through cancer treatment. Yeah.
As you're sharing that, I was just imagining kind of being in that, in your shoes, and the feeling that came to mind was fragile. Like, I'm coming in a little fragile. Like, I need to be taken care of a little bit just so I can have that transition of having so many take care of me to now you're just expected to go running on your own. And
you are, but also you aren't, because there's this judgment that happens too with the whole like, oh, oh, how are you doing? Super soft. Are you okay? And I would say that a lot of us are kind of like not wanting that, because we also want to be seen no longer as this like patient. The truth is, do I need accommodations and am I at 100%? No. But do I want to be seen and asked about it all the time? No.
Right.
So most of us, I can't really speak for everyone, but just also talking with my support group.
Yeah.
Like we just we want to be allowed to just live our lives again without having to answer all the questions, without having to be that special sick girl again in the office.
Yeah.
I don't need people telling me how good my hair is looking now that's growing back. I recognize it's a nice compliment, but it doesn't really help me, because they're like, oh, the short hair looks so good on you. But like, it's not my choice. So I appreciate that you're trying to be nice, but it just makes me bitter.
Yeah.
So like, there's this need of like not being seen as a sick person anymore. And yet the truth is, we also usually can't operate fully as a not sick person. So we're stuck in this in between. And it's asking the impossible of everyone around us who doesn't understand, and there's no way we can word it. And yet we're also in that same issue. So it's just this, it's difficult.
Yeah.
The survivorship world is difficult. The transition's hard for everyone. There's no right answer. The path looks different for everybody. But I found that when survivors find each other, it makes a huge difference.